Dr. Whitty, congratulations. I understand that you will be opening a new Lewisville business on July 1st, and it will be called Whitty Physical Therapy.
Yes, that's correct.
Can I ask you, why did you decide to become a doctor and practice medicine, and why specifically orthopedics?
Well, when I was back in high school, I went through several knee surgeries that required the attention of a physical therapist. And then again, in college, I had a pretty significant back injury that required the attention of a physical therapist. And in going through all those are orthopedic-related issues. Moving forward, I always knew that I wanted to work in the healthcare field when I got older and help people out. I've always had a tie to orthopedics and sports-related injuries, and that's kind of how it started.
I understand that after receiving your degree from Creighton University, you were the clinic director at Macavecca Physical Therapy. Tell me a little bit about your experience there.
Yeah, so I graduated from Creighton in 2010, and then I accepted one of the residency positions for orthopedic program, which essentially allows you to sit for your orthopedic certification exam. And if you pass that, you're able to call yourself a board-certified orthopedic physical therapist. So that was a year program where I spent about 60% of my time out in the clinic treating patients with Macavecca Physical Therapy, and another 40% in the classroom helping to teach graduate students physical therapy-related material, and also taking some advanced classes myself with my orthopedic residency mentor. From there, moved on to Macavecca Physical Therapy full-time, became a clinic director about 9 months after I started as a resident, so I was still a resident, was promoted to clinic director. And then from there have worked both at their Maple Street location and also at their 90th Street location, which is considered one of their bigger clinics, dealing with everything from seeing patients who have orthopedic issues or post-surgical issues to patients who come in with just generalized low back pain or joint pain, all the way to patients with some neurological issues, while overseeing a staff of 2 other physical therapists, 1 or 2 other physical therapy assistants, and then several support staff on top of that.
That's a tremendous amount of experience. You've chosen to open your practice here in Lewisville as opposed to a larger market like Los Angeles or Minneapolis. Is that because of your roots here? I understand that you were once a Lewisville Lion.
Well, yeah, that's a big part of it. There was opportunities to look into Omaha and that sort of thing, but Omaha really is not where I grew up. It's not home. When you look at providing services to people, Omaha has a wealth of options for physical therapy. And you look at Lewisville and Cass County, the options are fairly limited. So the opportunity to both move home and to serve an area that doesn't have these sort of services was a big part of it. Even though the business is located in Lewisville and that's the primary home base for the business, I grew up in Cass County doing things, Cass County Fair, Boy Scouts, 4-H groups, that sort of thing. So the goal is to really work on servicing and supplying services to all the communities around Cass County. Once you're eligible to sit, you take the test, and it's a test that's actually a little bit more involved, physical therapy certification test, very similar to what a physician goes through when they graduate from med school. They take board tests to become a certified physician in the state of Nebraska. But if they want to be specialized in orthopedics or sports medicine, something like that, they have to take an additional board exam.
What sort of event or condition would benefit from physical therapy? Does there have to be a life-changing...
There does not have to be a life-changing accident or something that happens to you that's traumatic or life-altering. We treat everybody from someone who comes in with an episode of low back pain to someone who is getting ready to have surgery done, to someone who's had surgery, needs rehab afterwards, athletic injuries, work-related injuries, liability-related injuries like a motor vehicle accident. We do consultations with people who are unsure if they require physical therapy services. We can provide screening for people who are looking to see if they're fit or able to do certain types of jobs. We can do some patient education things as far as what to take from their physical therapy services or effect after certain surgical procedures, that sort of thing. So physical therapy really can cover. The nice thing about physical therapy services in the state of Nebraska is that it's a direct access provider, meaning a patient does not need to have a script from a physician to come and see us. They can just walk through the door, schedule an appointment, we can see them without them seeing their doctor previously, which can save the patient some money if it's appropriate. There are times where a patient may walk through the door and not have seen a doctor, and we do a examination of them and determine that it's in their best interest to go see a doctor before continuing physical therapy services, and we certainly will refer on for that issue or those needs. But that is a nice aspect of Nebraska, that they do have the direct access for physical therapists. sometimes insurances don't work with direct access, and that's something we can help patients through as well, to understand what their benefit coverages are and to get them where they need to be to get. Say there's a high school football game Friday night and an athlete gets injured, they can give me a call on Saturday morning, and I can come in and see them. I can do an examination, determine if they require physical therapy or if they would need to go see a doctor for a more complex issue, and then we can also work with their insurance to see if the insurance requires them to see a doctor or not to receive further physical therapy care. The same thing would hold true if you're out doing yard work on Saturday and you bend over and you have back pain. You could come in Monday morning and get that same sort of service from us, and we would help you work through that process. But again, the state of Nebraska is kind of not very well known, unfortunately. The state of Nebraska does not require a script for physical therapy from a physician for you to access a physical therapist.
Interesting. Will you be working with kids in athletics? And if so, how old do they have to be to benefit from physical therapy?
Yeah, we can see kids as young as 3 or 4. I mean, the youngest patients I've seen in my career is a 3-year-old. If it's an orthopedic or an issue that's what I would call a non-congenital or non-developmental issue, certainly we can see them. Broken legs, aches and pains, sprained ankles, all sorts of that stuff. If it's a congenital issue with cerebral palsy, or a developmental issue, an issue that may require some specialized services, those things we may end up referring on to Children's Hospital, someone that deals with those sort of issues on a daily basis. But if it's not developmental and certainly just injury-related or pain-related, that's something we can help with. I'm in the process now of working with several of the school districts in Cass County to see what we can do to help their athletes or to help their students who maybe aren't athletes but are in other activities get the services they need should there be any issues that arise.
Your new facility will be there on Sand Hill Circle. Where exactly? And will there be any kind of grand opening or build ribbon cutting event?
Yeah, so the building right now currently in construction. Sand Hill Circle is located just under the water tower where the new Napa store is being built, and then where Derby's heating and air conditioning and their services are located up there as well. So the building will be up there. It should be open in midsummer. I am beginning to work with Build and be a part of that. The plan is to have a grand opening. How that all is going to be orchestrated, when that's going to be, is still being determined, but the goal would have it be somewhere around early to mid-August when school starts. So it's, I would say, in the infant stages of being planned, but certainly when it is all set up, there'll be information distributed out and get their questions answered.
Well, thank you, Dr. Woody, for spending some time with me this morning.
You bet. I appreciate the opportunity.
Okay, and congratulations and the best of luck with your new practice.
Thank you.